What's going on, guys? Tony Maritato here. Welcome to Learn Medicare Billing. So in this video, we're going to go through answering some questions I had during a conversation with a physical therapist assistant. So this particular assistant was interested in getting out of the skilled nursing world. She saw the writing on the wall, what's changing between home health care and the 15% Medicare reimbursement cut for PT assistant services. And she just wanted to take control of her future, right? So we jumped on a call. And I don't usually do calls, but this was somebody that I had a connection to from a while back. And I said, okay, well, what do you want to do? Now, her intention was to go into private practice. She wanted to have a mobile operation. She wanted to figure out what her options were. And I think that's what this video is going to cover is, what does the landscape look like right now? You know, I've said multiple times, and I'm saying it right now, I think I've never seen a better opportunity for a therapist or a PT assistant, OT assistant to go into private practice. The environment is like ideal. In 20 years, I've never seen a better opportunity than right now for somebody to go on their own. I think assistants have a competitive advantage. Let me say that again. Assistants, an occupational therapist assistant, a physical therapist assistant, you have a competitive advantage. You don't have the debt burden that a therapist has. You have the freedom to kind of go out and do your thing. You can work with therapists. And one of the topics that came up during our conversation, the person I was speaking to said, oh, I wish I would have been a therapist. And I said, I really don't think you do. And this is the truth of the matter. As a physical therapist, I am a physical therapist. My default is always going to fall on, I treat the patient, right? We get more referrals than we can handle. I step back into patient care. I'm always the easiest one to hire. I'm always the first one to step in and do what needs to be done. The problem is that handcuffs me to the patient care realm. That handcuffs me to, I can't expand, I can't grow, I can't make my business bigger. As a therapist, I'm limited to the number of units I can produce in a day. As a non-therapist, I have no limit. I could hire 1,000 therapists if I had the ability and produce, hundreds of thousands of units in a day, right? So not being a therapist allows you to work on the business instead of in the business. It's the golden handcuffs. It's a horrible trap. So I would tell you, if you're an assistant out there watching this video, you absolutely have multiple advantages. You don't have the debt of PT school, OT school. You don't have the fallback of doing all the patient care yourself. And it will force you to become a better business owner. And that is really what this is all about. Okay, so let's look at the landscape. Let's try to figure this out. What are the opportunities for a physical therapist assistant, an occupational therapist assistant right now? Today is November 5th, 2020. Okay, so option number one, you can go the conventional route. You can create a company, an LLC, a PC, whatever it is that's allowed within your state. That's a question for the state. Go to the Department of Corporations or whatever your state has, and see what kind of business entity you can create. Typically, it's either a limited liability corporation or a limited partnership or something along those lines. You create your company. It's a separate entity from you. That can be done through an attorney, through LegalZoom, however you want to do it. As an assistant, you personally cannot contract with Medicare, but your business can contract with Medicare as a clinic or group. Okay, so what's going to happen is, if you want to go the conventional route, you want to provide outpatient therapy services in the home, you will create your company. You'll go to Medicare, specifically you'll go through PCOS. You'll submit an 855B, which is the application that gets your company Medicare contract provider number, a PTAN. Okay, so now that you have your company contracted with Medicare as a mobile only Part B provider, now you're going to find a therapist. Because going this route, you absolutely have to have a therapist on staff who's going to do your evaluations, who's going to do the supervision, all that kind of stuff. So you go out, you find your therapist. Most likely that physical therapist or occupational therapist already has their PTAN, their own Medicare provider number. But if they don't, what they will need, they'll need an individual MPI. They'll need an individual Medicare PTAN, and then they'll reassign that PTAN to your business. So all of that is free. None of that costs any money to complete. I've got the videos, the tutorials showing you how to go through the PCOS enrollment so that you can fill out all the information correctly. Right now, applications are processing really fast, like 2 to 4 weeks on average. You could technically start treating Medicare beneficiaries once your application has been received, but some people will certainly want to wait until the application has been approved and the PTAN issued or the reassignment has been confirmed before treating their first Medicare beneficiary. So let's go through the steps. So you created your corporation, no problem, piece of cake. You submitted an enrollment application for that corporation to be a clinic or a group contracted with Medicare as a Part B provider. You found a therapist. You reassign that therapist PTAN to your group. So now the momentum is going, the ball is rolling. So now the therapist is allowed to go out, treat a Medicare beneficiary in the home. You obviously have to figure out what are you going to use for documentation. It could be paper documentation, it could be electronic documentation, it could be a combination, some paper, some electronic. You need to figure out how you're going to submit a claim to Medicare. Some Medicare Max will allow you to submit claims through their portal. All Medicare Max are required to accept paper claims if your company is small enough in size, which most likely it is. Or you could go with a clearinghouse. A clearinghouse is a company that has a website that will accept the claims that you create, submit them to the appropriate payer. Then the electronic payments remittance advice will come back through the clearinghouse and import into your software. There's free patient accounting software, there's paid patient accounting software. All of this can be covered, but I want you to get the big picture understanding. So we've got the company, we've got the therapist reassigning benefits, you figured out how you're going to submit your claims, how you're going to document. Now we're looking forward, and forgive me, obviously there's compliance, regulatory compliance issues that need to be covered. We'll cover that in a separate video. I'm going to refer you to Nancy Beckley. She is the compliance expert. But moving forward, so now we're looking at, okay, so what do I do? How do I market? How do I get that first Medicare beneficiary to call me up? Well, you reach out to the physicians that maybe you already know. If you don't know physicians, you create a referral pad, very basic, 8.5 by 11 sheet of paper. You have a glued pad. It can be black ink on colored paper or black and white or whatever you guys want to do. There's lots and lots of templates online. Keep it simple. Create a referral pad, start building relationships, start connecting with physicians and other local referral sources. And then you get that first Medicare referral. They call to schedule. You book the appointment. You collect the required demographic information. You have your admission process that you'll be working on and creating. That is part of the value of your business. Within that, you'll have your financial policy. You'll have your HIPAA privacy notice, and you'll have your consent to receive medical care. Those are the 3 documents that need to be signed before you can begin treatment. And in a typical situation, your physical therapist will go to the home, complete the initial evaluation, develop the plan of care, send that plan of care out to the physician or non-physician practitioner for signature. That is the certification. That's what's required by Medicare Part B in order to provide a covered service. And then between you and the therapist, you decide, okay, who's going to do the follow-up care. If you, the physical therapist assistant, is going to do a certain number of cares, there is required participation on the therapist side. All of this is covered in the Medicare guidelines, CMS Chapter 15, Section 220. Go find the references, look at what they're offering. You submit the claim, you get reimbursed. A couple common questions. Most patients will have a supplemental secondary insurance. If it's a supplemental insurance, they will typically pick up all or a portion of the secondary that Medicare doesn't pay, the co-insurance. If the patient does not have a supplemental, the patient's responsible to pay you that 20% of the Medicare allowed amount. But knowing that most patients, most Medicare beneficiaries have a supplemental, you do not have to contract with the supplemental policyholder. So if it's an Anthem Blue Cross Blue Shield supplemental, they will pay you even if you're not contracted with the supplemental, as long as you're contracted with Medicare. Okay, so that's always a common question. There is a website within CMS that you can go to look up the Medicare physician fee schedule. It's called the Lookup Tool. I've got videos on that. You can find them through my channel. So if you want to get an idea what Medicare allowed amount is, what reimbursement is for your state, for your region, go to the CMS physician fee schedule lookup tool. Put in the CPT codes that you're looking for, the calendar year and your MAC, and it will tell you what the maximum allowed amount will be. There's going to be reductions, there's MPPR, there's sequestration, there's other stuff. Don't worry about that for now. This is going to give you a rough idea of what you can expect. Okay, and that is the conventional model. Now, let's talk about the unconventional model. Let's talk about taking advantage of some of the opportunities that exist right now because of the current public state of emergency. So, Medicare has relaxed some of the guidelines. Under normal situations, for Part B, Medicare Part B, a physical therapist assistant, occupational therapist assistant cannot treat a Medicare beneficiary in the home or in the clinic without direct on-site supervision. So normally this would not be an opportunity for you, but because they've relaxed the guidelines, they're allowing indirect supervision as long as there's telecommunication with the therapist and your state practice act allows it. For now, Medicare is allowing the assistant to treat the beneficiary in the home without on-site supervision. I have no idea when it's going to expire, but it's active right now through the end of 2020. So that's a huge opportunity for you, because normally you would not be able, as an assistant, to treat a Medicare Part B beneficiary without a therapist on site. Other opportunities. Right now, telehealth is a covered service under Medicare Part B. So even if you don't want to or can't find a physical therapist who's willing to go out to the home and do the in-home evaluations, but they are willing to come work with you, you could go to the home. The therapist could do the initial evaluation through telehealth. You would physically be in the home with the beneficiary. The therapist does the evaluation, develops the plan of care. You render the follow-up services for the initial session and all subsequent sessions within the guidelines established by Medicare, as long as the therapist is actively involved in the case. And thank you, telehealth. All of a sudden now, you're able to access any physical therapist in your state who's willing to work with you on this project. I think this is a huge opportunity, and I haven't seen anybody taking advantage of it, like in a good way, not maliciously. So let me review that one more time. Let's say I am the physical therapist. Let's say you're in Ohio. You are a physical therapist assistant in Ohio. You contract with me. I reassign my personal PTAN to your business. Okay. You have a Medicare beneficiary who needs treatment in the home. You live 5 hours away in the state of Ohio. No problem. You tell me, Tony, I'm going to be at the house at 2 p.m. Can you do the eval through telehealth at that point? I say yes, absolutely. At 2 p.m., I jump on a HIPAA compliant platform. I do the telehealth evaluation. You are with the patient in the home. As I complete my evaluation, because I am the evaluating therapist and I'm dictating the plan of care and creating the plan of care, now you can provide the remainder of the treatment session. If I say, Mr. PTA, what you're going to do is I need this much manual, I need this much exercise, and we're going to do this for therapeutic activity. You're ready to go. I finish the plan of care. I ship it over to the physician for signature, and everything is compliant. Now, based on my plan of care, you deliver the services. Everything is billable, assuming it's a covered service. Assuming it's a covered service. So now that takes us into the last part, because we're already at 16 minutes of this video. You have to fully understand and base your decisions on established policy and reference what is a covered service. So for example, I evaluated a new patient in the clinic about a week ago. She came in with left shoulder pain. There was no history of trauma. There was no complexity. She was not at risk for any medical complications. She was dressing herself, bathing herself, grooming herself. She did everything to come into the clinic. She arrived with shoulder pain. She woke up a couple weeks back. Her shoulder started to bother her. She's able to functionally do everything she needs. Manual therapy in that case, and when I say manual therapy, I'm talking about a little soft tissue massage, is not medically necessary. Hence, it is not a covered service. That opens the door to allow me to provide that patient with self-pay massage manual therapy as a component of the plan of care. So the plan of care doesn't only include covered services. In this case, the initial evaluation was covered. That is where I developed the plan of care, establish the goals, teach, determine if there's any requirements for equipment. All of this information is in CMS Chapter 15, Section 220. But based on my analysis and assessment of the clinical findings, massage was not medically necessary, but it feels really darn good. So I offered that as part of my program. Dear Mrs. Patient, these are the things that are covered by Medicare. I think you would feel really good with a 15-minute massage sitting in the chair out in the gym, either before or after your workout. It helps with recovery. It helps with tissue, exercise performance. But it's not medically necessary, so it's not a covered service under Medicare. This is the cost for the 15-minute massage. The rest of the session is going to be 2 units of exercise, 1 unit of activity. Those are covered services because they are medically necessary based on your condition, based on my clinical findings. And the final outcome was she gets 3 units of covered care. She buys an extra unit of manual therapy that's not covered. She pays me out of pocket for the manual therapy. She receives the rest of the covered service, billable and reimbursed by Medicare. Really simple. But that is how we expand the scope of what we're able to do. That is how we provide our clients with what we believe they truly need and would benefit from. If you look at the ABN form right at the very top, second sentence, I think it says, Medicare does not pay for everything. Even though you or your healthcare provider think you may benefit, Medicare does not pay for everything. All right, guys, we're almost at 20 minutes. I'm going to wrap up this kind of summary, but there are so many more opportunities and directions this conversation would go. If you watched to the end, I appreciate it. Thank you so much. Please like the video. Please subscribe to the channel. Share this if you think anybody else would benefit from it. And let's keep this conversation going. I am happy to share unlimited ideas on how you can build a business model that allows you to do what you want to do and what you do best, which is care for the people who need your help. Guys, I appreciate it. I'll catch you next time.